Welcome back to Daniyal Ultrasound Clinic. This is Dr. Munir Abbasi. Today, the topic is how to differentiate between a hydronephrotic kidney and the renal cyst. From this image, you will definitely be understanding the type of the topic. Here is the clear cut. Baba sahab adu mathe kadi rokyo. Thodo. Na ite. Okay. Now we have to differentiate between the renal cyst and the hydronephrotic kidney. Sometimes it becomes quite difficult to understand when the renal cysts are in between the hydronephrotic kidneys, or when there's hydronephrotic kidneys, there are cysts. It becomes sometimes quite difficult to differentiate between these two entities. So today we have chosen this topic to understand all these things. Now, hydronephrosis is dilatation which occurs within the pelvic calyceal system. That's the central collecting area of the kidney. You will see multiple connected anechoic areas extending from the renal pelvis into the calyces. Like I just show you here. You see. In the real time shows us these are calyces which lead us. Which lead us to the renal pelvis. This is the one method which lead us to the renal pelvis here. This is kidney. This calyceal system is dilated, which is taking us to the pelvis where ureter in most of the cases is dilated. Here it is less dilated, but it is. So this is hydronephrotic kidney. Now here is the cyst. How to differentiate it? In many cases, most of the cases, it is located within the renal cortex like this, or in the parenchyma, and often it's at the periphery or exophytic out of the surface like this, exophytic or out of the surface sometimes, and it's located in the cortex as well. Now the hydronephrosis shows branching, irregular or cauliflower-like anechoic spaces. The walls are formed by a thin renal parenchyma. See here, the renal parenchyma has been thinned because of the dilated calyces, and in cysts, they appear like a circumscribed structure. They are sometimes round, sometimes oval, anechoic lesions with smooth and thin walls, and they do not contain any echoes if they are simple. And in hydronephrosis, it may show internal echoes if it is infected hydronephrosis. So then we call it pyonephrosis when there is debris. And calyceal walls or septations may be visible, but here it is a simple hydronephrosis. So now come to the cysts. They are completely anechoic, like I told you, with a posterior acoustic enhancement. What is enhancement? These are when we throw waves right at the top of the cystic mass, they just cross the fluid and are quite visible at the inferior part. So this is called acoustic enhancement. If it was a solid mass, then this enhancement was obscured or almost nil. So cysts they show posterior acoustic enhancement very well. Now hydronephrosis, another important point is that these cystic areas, they are when they are looked like they look connected to each other in hydronephrosis. They are connected to each other. Whereas in cysts, there is no communication with the pelvic calcium system. They are connected in the hydronephrosis. They are connected and they lead us to the uh, pelvic area, as I told you earlier. But cysts do not show any communication. Neither they take us to the pelvic area. And associated findings would be that, like in hydronephrosis, it's usually accompanied by, as I told you, proximal ureteric dilatation, and sometimes there is renal cortical thinning. But here the cortex is quite healthy and intact. But cysts, they remain normal, and renal parenchymal amount is quite healthy, and it appears intact. This was all I wanted to share. Otherwise, diagnosing hydronephrotic kidney is quite easier on ultrasound, but sometimes it is complex and quite difficult to differentiate between these entities, like renal cysts. When there are multiple renal cysts occupying synocardial areas, it becomes quite difficult to differentiate it from the hydronephrotic kidney. So this was all from my side. Just that was a live broadcast, and please like, share, and comment whatever you want to ask. I'll be there to answer you. Thank you very much.